I am Dr. Shreedevi K N. I am a consultant surgical gastroenterologist working in Bangalore in Chirag Global Hospital. So there are, very broadly speaking, two types of hemorrhoids. There are internal and external hemorrhoids. Hemorrhoids and anal cancers, these are two completely separate entities. Hemorrhoids are nothing but a modification, small cushions present in the lining of your anal canal. So this is present in all patients, in all individuals, regardless of your age and gender. Sometimes when they become enlarged or when they become very congested, they can lead to problems such as pain or bleeding or swellings. Anal cancer, on the other hand, is a cancerous growth. That means it is an abnormal growth. It is a pathology which has developed in the anal canal. So usually this presents as a swelling in and around your anal canal, which may cause pain and bleeding in some patients. So hemorrhoids in all patients may not require any treatment, but if you have anal cancer, then you definitely require treatment for anal cancers. So what are the symptoms of anal cancer? Anal cancer can present as a painless growth present in the region. It can present with pain, it can present with mild discomfort, it can present with painless bleeding, but most commonly it presents as a painless growth in the anal region which may or may not bleed on touch. So how do you tell the difference between anal cancer and hemorrhoids? The problem is that both anal cancer and hemorrhoids can present in a very similar fashion. Both of them can present as a very painless growth in your anal area. So if you have a painless swelling in your anal area, how do you tell whether it is a hemorrhoid or whether it is anal canal cancer? If you've had the swelling for a very long time, for example, if you have shown to a doctor and previously you have been diagnosed to have hemorrhoids and the doctor has told you that you have hemorrhoids, but then all of a sudden you notice that there is a sudden change. You are experiencing some new symptom which was not there before. You have noticed that you have bleeding, you have severe pain, or you have noticed a sudden increase in the size of the swelling. To differentiate between hemorrhoid and anal canal cancer, if you had no swelling previously and you notice that all of a sudden you have a swelling which is suddenly increasing in size, you have bleeding where you didn't have any bleeding before, or you have pain in a swelling which was lying quiet for a very long time, then these are some of the signs which mean that you have to go and get it checked to make sure whether you have just a regular hemorrhoid or whether it is something else more sinister such as an anal cancer. As a surgeon, how we differentiate between anal cancer and hemorrhoids is that we take a part of the tissue for testing. So one is we examine the area, and the second thing is we take a part of the tissue for testing and we confirm it on pathology that whether it is just a hemorrhoid or whether it is an anal canal cancer. Now let us say that you are diagnosed with anal canal cancer. How does one know what stage it is in? So apart from doing just a biopsy of that area, we will do some other tests such as a colonoscopy, imaging such as a CECT abdomen or even a PET-CT scan to find out what sort of cancer you have and at what stage it is. This is very important because the type of cancer that you have and the stage at which you are at will determine what sort of treatment you will require. Anal cancers respond very well to surgery, chemotherapy and radiation. So if you are somebody with anal cancer, then you may require all three or a combination of any of these treatment modalities. That is, you may require surgery, chemotherapy or radiotherapy or all of the three in a combination. So how you need to be treated depends on what type of cancer you have and what stage of cancer you are diagnosed at. So depending on what stage you are diagnosed at, your surgeon will be able to tell you whether your anal canal cancer is at a very early stage and it can be cured completely, or whether it has advanced a lot and only some palliative or make-do measures can be done to make sure that you live a comfortable life without any symptoms. So without knowing the stage of your treatment, it is not possible to mention whether or not anal cancer is curable. But yes, if detected early, anal cancer is definitely curable. Are home remedies useful for the treatment of proctology conditions? Now, when we talk about proctology conditions, there is everything from something as simple to an anal fissure or a cut to something which can be life-threatening, such as severe obstruction or anal canal cancer. So, without knowing what you have, it is extremely dangerous to try and take home remedies without knowing what is the underlying cause of your problem. So when we say constipation or piles or fissure, unless you know that this is what you have and this is the diagnosis that you have been given, I would strongly advise everyone watching out there not to take home remedies without undergoing a proper examination first. So once we have examined our patients, whether they come to us with pain, swelling, bleeding, when we have examined them and once we have established a diagnosis, for example, if a patient is suffering from fissure, then all they need is some simple application of ointments and sitting in warm water, which we call as a sitz bath. So these sort of simple remedies which can be performed at home is all that is required to treat a condition. But again, I will reiterate that unless you know what your problem is, kindly do not take home remedies, however simple it may seem to you. Once you have a problem in the anal area, whether it be just simple itching or discomfort or severe bleeding, kindly consult your surgeon to make sure that you know what is the cause of your problem. And once you have achieved a diagnosis, then you can take home remedies or simple medical treatment to make sure that you come out of your problem. However, if you have already started taking home remedies for some problem that you have experienced from the past few days, months or even years, and you don't know why it's not improving, there are certain signs that you can watch out for which can be considered as warning signs, which means that if there is something which you have noticed that is there, for example, if you have a skin tag which has been there for a very long time and it's not causing you a lot of pain, and all of a sudden you have noticed that it's causing you a lot of pain, or it has started bleeding, or it has suddenly increased in size, or you are noticing some newer swellings coming from inside or around your anal canal which was not there before. So if you notice any new symptoms, or if you notice the worsening of your symptoms for which you were taking home remedies, then that is a sign which means that you need to take immediate surgical attention. You need to go consult a doctor and you need to find out whether the problem that you were taking home remedies for is something very benign or something which is a little more dangerous.